I've done a number of reports working with First Nations groups on health and well-being of Aboriginal people in BC. And although it's clear that they have, in general, worse health status than non-Aboriginals do, the gap is closing by and large in most areas that we look at. There are a few that we really need to pay attention to because they're not improving. So if we look at low birth weight or prematurity, deaths from alcohol or deaths from HIV/AIDS, those are going in the wrong direction. If we look at some of the determinants like housing, that clearly is getting worse as opposed to getting better. But one of the big recommendations that come out of the evidence is that if people have control over their institutions, including the healthcare system, if they can plan it, deliver it, and be accountable for it for themselves, they tend to be healthier in the long run. And I think that the transfer of the to the First Nations Health Authority of all of the resources from the First Nations Inuit Health Branch, and having the 203 First Nations communities in BC working together to develop the agendas for health and well-being as opposed to necessarily just sickness care will make a substantial difference in the longer run.